I am unable to resist the conclusion that this strike, like some other ones, have been carefully designed to enrich private medical practitioners by shutting down public hospitals so that those who need medical help have no choice but to go to private clinic, where some of your members who are on strike from government work are at work in private clinics. At the eve of the birth of our Lord Jesus Christ, that we celebrate called Christmas, you choose to watch people die. And that's why yesterday I told the commissioner to put you on notice that everybody has options. That if doctors choose not to work, I am sure they also know they have elected not to be paid.
That was the threat of no work, no pay by Edo State Governor Comrade Adams Oshiomhole to striking doctors in the states. Reacting to the threats on doctors by Edo State Governor Comrade Adams Oshiomhole, the National President, Nigerian Medical Association, Dr. Osaon Inabuleli, said it is not the responsibility of the state government to determine the legality of doctors' strike, owing to the fact that NMA is not subject to any state government.
Those statements created to the Comrade Governor, I must say, are very unfortunate. They are unfortunate statements because it's least expected of a man who once led the labor union in this country at the apex. And so it sort of exposes the fact that perhaps what we are seeing here is an extreme level of dualism and a bag of contradictions, which honestly shouldn't be. Because number one, it is not in his power and position to determine the legality otherwise of a strike action. He has no such authority. And the fact that he's a governor does not mean that he can begin to pontificate on such issues. The issue of no work, no pay, it's something we are well in this country. And we know that governments always rush to implement what we consider as anti-people policies. Because here in this country we had doctors who worked for 4 months who did not receive any salary. How are you going to compensate such doctors? So when people are not fighting for their rights, you rush to implement laws that are anti-people, laws that are draconian, which are again not encouraging to people who need to, of course, exercise their right to determine how they want to, of course, exist as a group, as professionals. And again, today we have a government at the national level that is totally giving opportunity for freedom of expression. Are you therefore saying that you are doing this to cow people to submission, to, of course, make them not to be able to, of course, stand up for their rights? I think we should be careful the way we engage our workers.
Dr. Inabulele said tens of thousands of Nigerian doctors have migrated out of the country following government's failure to address issues raised, especially what he describes as injustices to Nigerian doctors. The national president said NMA has resolved to go on an indefinite strike on the 6th of January 2014 if their demands are not met.
ASU declared a strike action. You saw that all chapters of ASU, including the Abrusali chapter of ASU, went on strike. I am not aware that at the state level they had this policy thrown at them of no work, no pay. But in any case, if that is thrown at doctors, that will not undermine our resolve to, of course, ensure that our legitimate rights are, of course, preserved. Today, as I speak to you, lots of Nigerians are still spending out of their pocket to procure their healthcare services. Nigeria is one country that should have no excuse not to have a financing mechanism on ground, especially as people are paying their taxes, to have some financing mechanism to ease that financial burden from Nigerians. In South Africa today, as developed as South Africa is, as developed as Britain is, for as long as you are paying your tax, you have no other contribution that you have to make. You go there to procure healthcare services, even when you have head injury. So in Nigeria, that is not the current situation. And the NMA is saying that time has come for us to agitate for that on behalf of Nigerians.
The demands include appropriate funding of Nigeria's healthcare system, expansion of universal health coverage to cover all Nigerians, upgrading of health infrastructure, amongst others. Roslyn Igbinomaya reporting.